there, and welcome to Not Your Average Breakdown podcast. I'm Claudia, and my friend Alex and I are here to chat about all sorts of things happening in the world today. Now, I have a confession to make if you're new to this podcast. I'm not exactly a fan of reading the news. It's just not my thing. But luckily for me, Alex is on top of it and does all the research, so I don't have to. Isn't that right, Alex?
Yeah, baby. I'm here
That's
for it.
all you. That's all you.
I live and breathe news.
You do. It's sick.
Actually, when we were talking about this topic, you texted me and you're like, I really feel your excitement, which it sort of made me feel like, is she taking a jab at me or something?
No,
Uh,
I mean, like, listen, I know when a topic is good to talk about because you have a passion for it. You are very clear on your stance on many, many things. So when it comes across where I suggest something and you're not into it, that comes across. And so it's not worth us talking about because you're not going to enjoy it. It's going to be more of a chore for you than anything else. So I like when you get excited because then that's just better for our chemistry.
I don't think it's as much of a problem. Something being a chore is just I really try to, and you know this from our friendship as well, because we have been having these discussions for a couple of years now. When there is a topic, I really try to give you an unbiased opinion.
Mhm.
In our private discussions, I will give you my opinion and I will express my beliefs and political opinions and stuff. But on a podcast, I don't want to do that because we're not a political podcast.
Mhm.
Some topics that you brought up recently that you wanted to discuss, I didn't want to discuss in a public setting just because I knew there was no way going around it. I just don't know how to be unbiased on certain topics. And so this is the reason why we're not covering them. I will discuss that all day in my private life because I that's what I do and I love to debate. So that's not an issue, but I feel like covering topics like the one that we're covering today and the couple of that we covered in the last couple of weeks are more beneficial to our listeners
Mhm.
than us expressing a political opinion because everybody has it.
Right.
So I feel like they can get that from somewhere else. We're trying to deliver news and spark people. I mean, we only have, our podcasts go from like 40 to maybe 55 minutes. So we just provide a high level. And then what my wish is for our listeners who maybe are like you that don't follow the news is that sparks something in them if they're interested in the topic and then they know how to go and find other resources.
Yeah, I look at these as more informational than anything else. And we don't want to, because then you could just go read some random news article that's already biased and wants to put you in a direction. And that's why I don't do that. I don't read those sites because you tend to get your information from multiple sources and you come to me and you're like, "Okay, I have cross-referenced all these things and this is what I gather."
Yeah, I agree. I try to get different perspectives. If we're gonna debate something, especially highly political, I want to get opinions from both sides. That way, I can form an opinion for myself, and
Yeah.
then I can try to deliver it the best that I can on
Mhm,
this
and
podcast.
I appreciate that. Yeah, exactly. That's why we do this. That brings us to this week's episode. We're diving into a pretty intense Senate committee hearing where lawmakers are giving major drug company CEOs a serious grilling. And we're going to tell you why. So, this just occurred yesterday, Alex, and it came on my radar. And of course, you were already into it and already involved in it. And so, makes it perfect topic for us to talk about today.
Okay, so we're on this streak, I guess, of congressional hearing. This is like the third or fourth that we already did.
Yeah, but you know what's interesting shit? Like, I don't have time to watch this shit and hear about it, but there's a lot of drama that goes on those things. So it's really exciting to talk about, but like the issues are huge. So
Yes, and I think that's why we're covering them, because I feel like 2024 has just started off strong for the government, and I love it because I talk about all the time about polarization and whatnot and publicity of both parties and stuff, but this is how our government works, right? Like,
Mm.
we have a free market and free government, and a lot of companies are covered by First Amendment and stuff. But when the system is broken, the government needs to step in and try to fix it. And if you know me in my personal life, I always talk about corporate greed, and lobbyism is a big one that comes up on our podcast all the time. And this is like one of the main reasons why I went into forensic accounting. So, like, these topics that we're discussing that involve congressional hearings and grilling of these corporations is aligned with like what I am passionate about. And so I think this one is very important to talk about, in the same line as our social media safety for children, a congressional hearing that we covered a few weeks ago. I think that one was equally important as this one, because this literally affects millions of people.
Oh, yeah, definitely. I mean, the sad truth is there's a lot of people that can't afford the meds that they need to stay healthy. So this applies to everyone.
Yeah, absolutely.
What I did want to ask you before we even start this, because we've been on this roll, what is the role of a Senate committee hearing? Where does it go from there? What's the purpose of it? Can you talk a little bit about that before you actually get into the hearing?
Sure. So the government is construed of these committees. So you have a judiciary committee that we just recently talked about in our social media platform hearing. You have Senate Intelligence Committee. You have Homeland Security. I mean, finance. You name it, we have it. Okay, and usually those committees are bipartisan committees. So both Democrats, Republicans, and independents are on it. It is, I really don't want to say the word background, but I feel like I don't have a better word, but this is like the work in the government that's done in the background, because you see a lot of shit going on TV. Okay, they all blast each other and post all these wow factor tweets or whatever, right? Like, they are as polarized as it can be. But when it comes to bigger issues, they do work together, and they this is how our government works. Okay, so these committees are working on one issue. Okay, so let's say when we were covering the aliens episode, their job is to ensure if the government agency is broken, as we suspect what is happening with the Pentagon, they get involved, because I feel like people forget that the US is government of the people, for the people, by the people. I don't know if you hear that. I feel like we don't hear
All
that
the time.
often.
No,
Yeah.
no,
And we should, because that is what our government is supposed to do. Okay. So we are reigned by the people. We select those people that to represent. We don't have kings and queens and emperors. Like, we elect private citizens to run our
right.
government, to represent us. And then I think what also people forget is that we are not accounted to our government. The government is accounted to us,
Right.
because we pay taxes and the government gets funded through our own money. And so they have to be accountable to us. And that's what these different committees do.
Okay.
They make sure that the process is functioning properly.
Ah,
So,
okay.
in the case of our CEO of social media platforms,
Yep.
congressional hearing, because there is this ongoing concern with the citizens. Citizens are not as safe as they're supposed to be on social media, and that includes our children. The
Mhm.
government now needs to step in and try to regulate these agencies and tell them, hey, you need to fix your shit.
Mm.
And if you don't fix your shit because you have a lot of money and you lobby the government and nothing gets done, because you don't want to repeal this Section 230, you don't want to introduce this legislation, you don't want to support it, and not only you don't want to support it, you put in a lot of money into lobbying these senators to struck it down,
Mhm.
right? So
Mhm.
it's the process is a little bit broken, but it's legal, so you can't really blame the process, I guess. In case, as we've seen, as I said, with that hearing, they are trying to introduce these legislations, and these legislations are there to try to fix the process. So the government gets involved a little bit into private sector and puts these broad regulations, either establishes a new agency that is going to regulate social media companies
Mhm.
or introduces a new act that is going to regulate internet as a whole. How are we going to deal with sexual explicit content, child sexual abuse material, all these things? Okay. Then they introduce these acts. They inform the public, these are the acts that we're introducing, and they're going to fix X, Y, and Z. And then the Senate takes a vote. Okay. And usually when it votes, it goes to the House and then goes into Senate, and then they vote, right? So every bill has to pass first from the House and then go to Senate. Did that answer your
Yeah,
question?
and it's great because foundationally we've already laid a lot of this information throughout our episodes. So it's great that it keeps, at least for me and anybody who's listening from the very beginning, can, you have a whole different wealth of knowledge to understand where we're at right now and what you just talked about, because we've slowly been covering this as we've gone along. So that was great. I understood exactly what you were saying, and I connected those dots. So,
Okay, good. That's good. So, Inflation Reduction Act was passed in 2022, and it was introduced by President Biden, and it was passed. And initially, what it was set out to do, well, it's supposed to cover a range of things, but we're going to talk specifically about one thing that it says in this act, and that is to lower the cost of prescription drugs, to include cancer medication, blood thinners, and insulin, which is one of the most expensive. Those are one of the most expensive drugs in the US currently. Before that, okay, the government was not allowed to negotiate with the pharmaceutical companies. Whatever the pharmaceutical companies told them that the cost is, the government would pay. And that is huge because we offer something called Medicare and Medicaid.
yep.
Okay, so Medicare for our senior citizens 65 plus, and then Medicaid, um, case to case basis. If you're disabled or have a lower income or whatnot, you might be eligible for it. And so, under those coverages, the government provides you assistance with your medication. But if the government cannot negotiate, and mind you, every other private insurance can. So if you have Aetna, TRICARE, United Health, whatever insurance that you have, even if it's Affordable Care Act, or also known as Obamacare, your insurance companies have the ability to negotiate prices with the pharmaceutical companies. The government did not have that before the introduction of Inflation Reduction Act. So this was already a huge thing for the
Yeah,
government.
it should have been a long time coming.
Exactly. There was a government was putting in a cap for all of our Medicaid patients, or Medicare, I'm sorry, for all the Medicare patients. The cap was at $2,000 per year for people in Medicare. So that means you will not pay more than $2,000 a year on any medication. And it limited the monthly cost of insulin to $35 for seniors, which is huge because Martin Shkreli, this dude, talk about the biggest piece of shit on the planet. So he was a CEO of a pharmaceutical company that was producing insulin. And he raised the price of insulin by 400%.
Wow, okay.
And the price of insulin skyrocketed to like $7,000. And it's still up there, okay? Because the government cannot, constitutionally, the government cannot get involved into how much the companies are charging for something. That is not a government's job. And so they could only open up investigations, do congressional hearings and stuff like that, but there was like nothing that the government could do. Luckily, the dude was so corrupt and, as I said, like the biggest piece of shit. He was blowing up corporate profits. He bought this like Wu Tang one of a kind, like limited album. I think it was like platinum or something that was going. It was like on auction for $300,000 or something. And so finally, the SEC got him on uh, accounting fraud charges, and he is in jail. But it took years to get to that point, right? But this dude was just like everywhere and didn't know, wasn't smart enough to like. For me, if it's like if you're gonna steal money, take the money and run. But a lot of these people don't know how to do that, and they
No.
just kept being in the spotlight, and the government was like, all right, we're just going to open up an investigation into you. And so that is what happened. So
You're spending that blood money. It's gross.
it's just despicable. It's what it is. But so he, if you're interested in stuff like that, there is at least on Netflix, there's one or two documentaries. One, I know it's called Pharma Bro. And then there might be one on like Amazon Prime or even Hulu. But yeah, Martin Shkreli, there is a huge case around him. I actually studied his case in one of my classes in college. So he's made it that far. The government capped this now to $35 per month for insulin, which is huge, right?
Yeah.
Because people are paying literally thousands of dollars for it. The fact that Medicare can negotiate prices, like that is also huge. And so but the problem is that now these companies, the private pharmaceutical companies, they sue the government. They said that Inflation Reduction Act is unconstitutional, and they put in all of these lawsuits. Okay, so that's where we were 2022. However,
Greed. That's called greed. Okay.
exactly. So that sort of open up the door for a series of events that happened since Inflation Reduction Act was introduced, which brings us to yesterday when a health education, labor, and pension committee, so that's another committee, right, that takes a look at like social welfare and stuff. The president of the committee is Senator Bernie Sanders. You know who he is,
Yeah.
from Vermont. Bernie, I love him. Nothing to do with politics. I just love the man. Like he's like your local grandpa.
Yep.
And he usually, as I was talking about a few weeks ago when we were covering the tech CEOs congressional hearing, Senator Ted Cruz, he's younger, and I mentioned that he can be very abrasive and rude in these hearings, which sometimes you have to do.
Right. Yep.
Bernie Sanders gives me the same vibe. He just is a little bit more respectful, but he also brings the receipts. Okay, so he had people behind him holding things. That was actually the first thing that I saw this morning when I was looking at news. I saw this clip on Instagram, and he was, pretty much yelling at one of the CEOs of this pharmaceutical company. And I was like, man, I don't even know how are we still at this, like, we know that they're greedy regardless of the industry. Every
Yep.
time you're bringing a CEO in front of there, it's because they did something unethical, illegal, or whatever. It's never because they did something amazing, right? So it's like, I was just like, oh my God, like they're going to give this poor man a freaking heart attack because
Are
he's
you
like, yeah,
you worried about Bernie? It
I
sounds
was
like
worried
Bernie.
about Bernie.
Yeah, it sounds like he's doing just fine. So he's good.
He's doing good. Like he was grilling them. Like he was doing his job. Okay. So the hearing was for the three CEOs of the major drug makers. And
Who
I
were
don't
they?
um it was Johnson and Johnson, Merck, and Bristol Myers Squibb.
Wow. Okay.
And essentially they were called up there because they had to explain why do they charge thousands of dollars more for drugs in the US than they do in other countries, sometimes 10 times more than in Europe and Canada.
What?
Okay,
What the actual fuck?
So this is from NBC News. This is where I watched the hearing, and according to Bernie Sanders, these are some of the stats that he said. Bristol Myers Squibb charges an annual list price for about $7,100 for Eliquis in the US, compared to around $900 in Canada and about $650 in France. Johnson and Johnson Stellara is $79,000 in the US, but $16,000 in United Kingdom. Merck's Januvia is around $6,000 in the US, but 900 in Canada and 200 in France. And this you can see the pattern, okay? We touched upon this in the last congressional hearing that we covered. These CEOs defended the costs, saying that those high prices are based on the value the medications give patients, which is
What?
complete, like, makes literally no sense, okay?
It's basically like, how much is it worth to you? Like, that's
E-
fucking bullshit.
Exactly. They were also discussing saying how there's more people in the US and stuff. I'm like, in that logic, then you should be charging it less.
Right. Right.
So, whatever. They also noted that the higher prices mean that US patients often get access to the medication years before people in other country, which is also irrelevant.
Mm,
I don't care.
not buying it.
Exactly. And this is like a little side note. I read a statistic or a fact. It's really not a statistic. Insulin has been around for over 100 years. Okay.
Mhm.
Insulin is not a new drug. We have been giving it to diabetes patients for 100 years. In logically speaking, that drug should not be $7,000. Okay. Because the new drug, I get it. They put in a lot of time in research and development. They put in a lot of money into research and development, which is
Mhm.
totally fine.
Right.
And now they're trying to, get some of that cost back by charging higher premiums on these drugs. But for an insulin drug that has been around for 100 years, why are you charging $7,000? At one point, it was like $34,000. It gets crazy, okay? Oh, I totally now I realized that I think that dude Martin Shkreli, it wasn't the insulin, it was EpiPen.
Don't fucking start with the EpiPen because I
I
got
know.
2 I got 2 kids that depend on the EpiPen.
I think I said insulin, but I'm pretty sure it's an EpiPen. So I stand
Okay,
corrected.
correction. Okay.
Correction.
I'm already enraged, man.
I know. I mean,
You mean irregardless because whether it's me or someone else, those things are needed for survival.
I remember Lynn, she had an EpiPen always on her,
Yeah.
and she told me that she couldn't afford it anymore because the price went to like $11,000 or something.
Is that
Um,
from the just one manufacturer? Because now I can get them.
Now, I was going to get into that. So pharmaceutical companies are supposed to allow competition, so
Yes.
they're supposed to allow generic
Yes.
brands, but some of these companies, and they were grilling them on that as well, because they said that they allow competition, but then they filed patents that prevented people from getting it. And so I think that was the case with the EpiPen. And yeah, it's EpiPen. I looked it up. Okay, so I issuing a correction in this episode right away. So initially I said insulin, but it's an EpiPen. But it stands still. Okay, like
Mhm.
the whole argument is still there. All right,
Right. Yes.
insulin has been around 100 years, and so it's really not supposed to skyrocket like that.
Mhm.
But because these companies make little adjustments, and we've seen that with Ozempic, and we covered
Mhm.
Ozempic. If you didn't listen, you should go back and listen to our Ozempic episode. Little plug for us over here. I mean,
Another one we covered.
Ozempic is not a new drug, but they made little adjustments and added just few new ingredients. That's the way they keep the patents updated, and they keep the prices up. If they just kept the drug at what it is, then the price would start going down, but they don't do that. So they constantly make additions to it.
With that
And
purpose in mind, to keep feeding,
yes,
the reasoning for them, to the justification for the high cost.
exactly. And so that's, what they were saying, like, why is insulin at, $11,000 or whatever when this is 100-year-old drug? And like, it makes no sense. And they gave bullshit excuses. Like, I don't care. I am all for corporate prosperity. I am all for building your empire and stuff. But when you start endangering people's lives, that's we have to draw a line somewhere. Like,
Yeah.
people are literally dying and getting new diseases because they cannot afford drugs, and they blame it on, well, if we don't charge the X amount of dollars for this drug, then that's going to affect our research and development, which is 100% not true. Okay.
You're full of
Like,
shit.
literally full of shit, because Bernie Sanders, the MVP that he is, okay,
Tell us about it.
he brings receipts, and that's literally what I like. Okay, so you can't bullshit with the facts. So he says it. Well, the CEO said it costs a lot to develop a drug, and I agree with that. That's why we will never have a universal healthcare system like their, UK and Canada are very famous for it. Their healthcare system sucks. Okay, I hate to say that. People are all for it, and I wish that would be the case. Okay, that we have cheap or no cost health insurance, but their healthcare system sucks because there is no incentive to invest into it. People are not putting money into research and development,
Oh.
because why would they do that? They cannot overcharge, not overcharge, but they cannot charge the fair price for stuff. So they rely on us, on United States, where we value competitive pharmaceutical companies, and they have the freedom to, spend as much as money as they want, and they can charge whatever money that they want. So I get it. We are in a competitive market, and we're trying to find a drug for whatever cancer, Alzheimer's, Parkinson's, insert disease, right? We're trying to find a drug, and we're putting a lot of money into the research and development, and then when we do have a formula, we have to do trials, and those trials can go up to like 10 years, and so it takes a lot of time and money and effort and resources and everything to develop a drug. I
Yeah.
100% agree with that. Okay. And this is why we pay for our healthcare insurance, and we pay the premium price, but we also have better healthcare system, even though it's fucked up as everybody else's, but
Right.
it's still, a little better. They talked about how much it costs to develop a new drug. However, what they didn't want to talk about, and Bernie Sanders brought this up, he wanted to talk about their corporate profits. Okay. So the 14 major pharmaceutical companies spent 87 billion more on stock buybacks and dividends over a recent 10-year period than what they spent on research and development. So you can't claim research and development, oh, we're spending all this money. If you slash our prices and now you negotiate with us, we're not going to earn as much, and then we're not going to have enough to put it into research and development. When you're putting $87 billion into stock buybacks and your dividends. So you're paying out your major shareholders in
Ugh.
dividends, 87 billion
You said
more.
you said billions.
Billions, I know.
Billions.
Literally. And so, and this is why I call bullshit on that. I 100% agree that they should be able to put in whatever money that they want into research and development, and then try to recover some of that money from the price of the drug. But you can't, like, deny that you have corporate greed.
Yeah,
Okay.
it's a farce. That's not true.
Exactly. And you oftentimes hear, and I haven't researched any of the pharmaceuticals recently, so I don't know, but I know from some different industries. Okay. When there is let's say there is an accounting fraud like Enron. Okay. We can go as back as Enron. When Enron happened, all of their C suite people got fucked. Okay, a lot of them got jail time. One of them killed himself. Like this whole thing, right? There was a huge congressional hearing, series of congressional hearings. And there were two major acts that were introduced since Enron to try to prevent this from happening. We still follow them up to today. Like I still work on SOX compliance, and I'm sure you heard that term as well because you work in a financial institution. And there there is a whole bunch of things that happen because of Enron, but the CEO, the CFO, and the COO, who ended up being the CEO of Enron as well, they all got jail time, but they all got their bonuses in millions of dollars. And this was 2001, okay? That still happens. It's 2024, that still happens. A CEO leaves because of an accounting scandal or whatever, insert issue, okay? We covered realtors.
Yep.
Their CEO that left because of the sexual assault abuse
Right.
or sexual misconduct, he still got millions of dollars in bonuses for his that was his like leave package. Okay, so no matter what happens, they always end up making money. So they're already paid, in millions of dollars a year, and then they get these yearly bonuses, and if they leave the company they still get a big payout. So don't bullshit me with your research and development.
This is terrible.
Yeah.
So I don't
um
listen to this shit because it just it's so disheartening because you listen to this and you're like, where's the morality, in this? It just doesn't exist.
It does not. I feel like pharmaceutical companies I have issue with a lot of them. And there is a whole thing with oxycodone. Okay, I don't know if you've seen that Netflix documentary. Well, it's a limited series, but it's like based on true events. Matthew Broderick's stars in it.
No.
It's about what is that family called? Purdue Pharma.
Okay.
Purdue Pharma. So they were the ones that invented oxycodone,
Okay.
and then they recruiting salespeople to go to all these clinics, hospitals, dental clinics, like you name it, and they replaced all of these like smaller painkillers with oxycodone, and they pushed it for they were giving money to these clinics and doctors and everybody who was making decision, paying them to prescribe oxycodone, which then fueled an opioid crisis. Hundreds of thousands of people died so far from overdosing and getting addicted to oxy. And then they ended up not, I think they were found not guilty, even though the case that was brought up in front of the court was that there were records of them pushing these people knowing that their product is causing addiction, but they knew that it's going to hit their profits. So they were pushing knowingly this drug that was literally making people addicted and ended up killing God knows how many of them, but they were ended up found not liable
How?
because lobbyism, baby. That's why. Because they have unlimited amounts of money that they can put towards you name it. You just need to find one judge, one juror that has financial issues, big credit card payment, is going through a divorce,
Mm.
is trying to put a kid through college, and that's it.
I'm gonna need a glass of wine tonight to calm.
I know.
I feel like my blood pressure escalating.
I know. And like, I'm very passionate about these topics. Okay. I base my whole career on this because I feel like this is not right. And I
Mhm.
don't care about your research and development bullshit. The same way I don't care about these social media platforms saying how they're protecting our children, but yet increasing number is the press killing themselves. And, we discuss it all. So,
I feel like we're in the twilight zone. Like this can't be true.
yeah. And I love that these hearings now are getting more coverage. I feel like a couple of years ago you would never hear about this, but it's the benefit of social media. Like for me, that is what social media is about. Okay, information, like useful
Mhm.
information to the public.
Mhm.
And you and I have these discussions for years now because I want to make sure you stay informed on certain topics, because I want you to go out and vote, but I also want you to be empowered to go out and vote. And this is how you make those decisions, okay? You see who supports these acts and who doesn't, okay? And I'm going to give you another little piece of nugget. You know, I'm pretty big in functional medicine, and it saved my life literally. And I listened to Dr. Mark Hyman. So he was saying on this podcast that he's big against sugar, not like cane sugar, table sugar, but like all of these other sugars that we have
Mhm.
introduced, that are really bad for our health. Okay, they're bad for everybody, and they're in everything, in our bread, soda, flour, like you name it, it's there, right? So he was talking to this senator. He didn't name the senator, but he said the senator had some health concerns, and Mark Hyman offered, his opinion, and told him like, hey, these are the things that you should do, and these are the supplements, and he prescribed him some supplements. A few weeks went by. He saw the senator again, and he was like, hey, how's everything going? And he's like, I noticed you lost weight. And he's like, yeah, I lost 15 pounds
Whoa.
just
Okay.
by he put him on this detox diet, right? And that's the detox diet that I follow, and I'm trying to convince Alan to do it now. So he put him on a 10-day detox diet, in which pretty much took all of the processed, ultra processed food out, and one of them was sugar. And he was like, yeah, I feel so much better, like, and I don't even crave sugar anymore. And Mark Hyman was like, oh yeah, that's great. He's like, how about we do detox, sugar detox for the entire Congress? Or can you like introduce it to your committee? And he's like, oh, I don't know about that. He's like, I'm on a candy committee.
Oh. Oh my god.
So
Oh
you
my
know that
god.
sugar is causing you all these issues. Once you got out of sugar, you lost 15 pounds, but yet you're on a candy committee. Well, like, what the fuck is a candy committee, first of all?
Yeah. Like such a thing exists?
Yes. So candy industry lobbies because sugar, okay, and corn is a government backed derivative. Okay. So the government puts in a lot of money into agriculture that produces corn. So the farmers in the 60s were like, we have so much corn. We don't know what to do with it. And the government was like, make whatever you can out of it. And so they started making high corn fructose syrup. And that's how they started putting it into everything. Now, the candy industry, because they use all these other forms of sugar, they lobby the government to make sure that the government doesn't put restrictions on our food. And the certain government agencies issue like food pyramids and what's good for you to eat and what's not. And they lobby those agencies through these congressmen to make sure that the government doesn't pass bills that will potentially slash profits of the candy industry. The same way, remember we covered the Skittles episode?
Mhm. Yep.
That bill that was introduced in California was called Skittles ban because they were trying to ban titanium dioxide. But the candy industry lobbied, and they ended up not banning titanium dioxide,
Right.
which was the main ingredient that they wanted to ban. But they ended up banning other four, which is still great. But that's what I mean.
Can't beat big money.
You can't. And I mean, lobbyism, you can compete. The government can compete, and you as a private citizen cannot compete because these corporations have literally unlimited resources to lobby as much as they want.
Right.
And that's, you see that very clearly now. I mean, this is the third or fourth congressional hearing that we've seen, and you
It's a
can
theme.
spot, yeah, like you can spot what happens. Like the government runs into these roadblocks because these industries lobby heavily government in trying not to pass these laws.
Yeah.
So
Yeah. No, I see it. It's the theme. We know it.
yeah, there should
Um,
there should never be a thing where we spend $7,000 on a drug.
no, it's really sad, honestly. Sad. So what was the culmination of this hearing?
Honestly, it's the same as every other congressional hearing, and that's really bad. There is a lot of unknowns right now. The lawsuit against the government is still ongoing. All these pharmaceutical companies that sue the government,
Yep.
saying that the
Okay.
Inflation Reduction Act is unconstitutional.
Okay. Fuck you. Okay. What else?
So, yeah, exactly. So, we don't know what's going to happen with that. If they win, and I'm assuming if they're not happy with the outcome of the initial lawsuit, that might end up at the Supreme Court. So, it might take years to get to a resolution. Okay. But so that's the first unknown. The second one is in this hearing, as with any other one that we've seen, these Congress people request certain documentation from the CEOs. They want them to provide supporting evidence, supporting documents, and stuff. And so these companies have to provide that. The Congress is going to review it, and then there will probably be a follow up hearing. So this is really the problem with these hearings is that yes, it brings the attention to the problem and like, okay, this is happening and our government
Right.
is trying to find a solution for it, but it literally can take years to
Yeah.
get to a solution. And now my other question is like, okay, how much money are the lobbyists going to spend to prevent another hearing or introduction of another act?
Who gives a shit how much they spend?
I mean, the senators do, the Congress does, because that's who they're going
Oh,
to lobby.
time and resources and
Exactly. If
mm,
I don't want to explain it as a bribery, but I really don't have a better explanation for lobbyism. And lobbyism works.
yeah, it's
That,
fucking
that's
call a
that's
spade. Call a
that's
spade a spade.
exactly that's how it works. Like literally, they in a very simplified terms. Okay, they're trying to prevent an act from passing. Let's say this pharmaceutical company has a drug and they charge $7,000 for it, and the Congress is looking into regulating that. Well, what they're going to do is they're going to hire a couple of lobbyists, and lobbyists, oh, by the way, are all ex government officials.
So they know the system.
So they know the system, they know the
They
people.
right, they have the connections.
Washington, D.C. is good old boy system. Okay.
Mhm. Mhm.
That's how it is. So they serve in the government for a few years, then they go work for this big lobbyist company, and then they make millions lobbying the government that they just came out of. Okay. So the system right there doesn't work from the start. So, but let's say this pharmaceutical company, they hire a lobbyist, and that lobbyist is going to go on the Capitol Hill and they're going to try to lobby these senators, and they're going to say, hey, if you don't vote for the passing of this act, we will donate $500,000 to insert super PAC, presidential campaign. We will support the defense budget bill. We will do X, Y, and Z. And so the lobbyists put that money towards that. The senator is like, oh, okay, yeah. And now that's more than true than ever because we are in an election year. So now you know that they're lobbying like their asses off. Okay.
Ugh.
The same way that they were lobbying, like there was this huge thing with AT&T last year where when Roe v. Wade was struck down, and it was revealed that AT&T paid lobbyists to lobby the government for both abortion, pro-abortion and anti-abortion because they wanted to play both fields depending on who wins in the election. So, it's not even that they have one stand, okay? They just go wherever they think it's going to be the best for them.
It's this game of chess that they're playing.
Yeah.
Oh my.
As long as the money is involved in
Yeah.
our government, we effectively are not going to be able to do much.
Money makes moves or stops moves. This is another big one. This
I
is
know.
another big one. It was tough, but you know what? This is not your average breakdown podcast, and we tackle tough shit.
This
But it
took a
was
lot of me.
yeah, but it was a good one. This was really good. I saw your enthusiasm for it, and I it's something that's very it elicits emotion, and it wasn't a boring topic for sure.
This is going to be a huge year because of the election, so I'm sure we're going to have a lot of political content to cover.
It is what it is, and it's all informative, and that's all, and that's what people need at this point in time, or at least that's why you would listen to us. So
Yeah, I hope this was beneficial, and I hope I explained some concepts that maybe you were not familiar with, or our listeners. And I know I get very emotional about this topic, but this is like, for me, this is my bread and butter.
yeah, that's what makes it good and makes it different, is that you clearly care, and that makes me care, and that makes anybody else who's listening. If you don't care, you shouldn't listen. Definitely not for you. But but the people who do will stay with us, and those are the people that are going to keep following and keep listening. So, and that's what we want.
Yeah,
So,
absolutely.
I thank everybody if you hung in here for this one, and you stayed in there, and you might need a glass of wine right now. I get it. I'm gonna head right there after this. So a big thank you for joining us today, and remember, just reach out to us. Our email, as you know, as I always tell you, nyabpodcast@gmail.com. Alex, you just announced some streaming.
Yes, so we are officially streaming on all platforms.
All
All
platforms.
platforms. So wherever you get your podcasts, we're there. Initially, we were only on Spotify and Apple, but I put in some effort. It took a little bit of time, but I made sure we were everywhere, and that includes Google Podcasts and YouTube Podcasts. If you listen to us through Google, they're going away from their podcasting platform, and they're gonna switch it to YouTube, and we're already there. I already uploaded all of our episodes. So,
Guys, get yourself an Alex in your life. That's all you need.
and yes, we are on all social media platforms. So if you prefer to connect with us that way, we
Do it.
are on any of those platforms that we just badmouthed 2 weeks ago.
Still too soon from that. Still too soon. We're gonna plug it anyways.
Yep.
So, oh my goodness. So much fun. Thank you so much. And don't forget to tune in next week, and we'll discuss another interesting topic for sure.
Thanks, Claudia. Bye, everyone.
Bye everyone.